Hey everyone, in this video we're going to be discussing labs and diagnostic tests. The first thing we're going to go over is the complete blood count. That is comprised of 4 different tests: the hemoglobin, hematocrit, platelets, and white blood cells. So I'm just going to quickly go over the expected normal ranges for these 4 different tests and a quick overview of the function of each of these 4 things. First, the hemoglobin. The hemoglobin is the substance that carries oxygen to the cells. This is represented in grams per deciliter of blood, and it's actually a little separate for men and women, but the total normal range is going to be about 12 to 18 grams per deciliter. This is one of our quiz questions, so this is the number to remember. Next is the hematocrit. Hematocrit is represented as a percentage, and it's the percentage of red blood cells present in 100 milliliters of blood. This also varies between men and women. So for men, it is roughly I'm going to represent men with an M, roughly 42% to 52%. And for women, it is 36 to 48%. I would personally just kind of round it out and say hematocrit is between 40 to 50% normally. Platelets, we are very familiar with what platelets do. They clot and they prevent blood from spilling out of the body. The normal platelet count is between 140,000 to 400,000 platelets per cubic millimeter. And what's important to know about platelets as they relative to our content is that certain medications can inhibit platelet formation, and that can include aspirin and clopidogrel. So what's important is to know if your patient is on either of those medications, they could be at risk for decreased platelet construction, which means they could be at a further risk for bleeding. So my way of remembering platelets is that there's a 4 in these 2 6-digit numbers, and for the low value, the 4 is in the second place, and for the high value, the 4 is in the first place, 6-digit numbers. And lastly, for the white blood cell count, the normal range of that is 4,500 to 11,000 per cubic millimeter. We're also very familiar with what white blood cells do, fight off infection, of course. So it's important to be monitoring this in patients who are at risk for infection, like patients who have just received a transplant of some kind or maybe have an autoimmune disease. Next, we're going to be talking about the PT with INR tests and the BUN test. PT, or prothrombin time, is used to help determine anticoagulation when using warfarin, but it's usually used with INR because the INR test, which is the International Normalized Ratio test, helps cancel out any other variabilities and isolates the effectiveness of warfarin. So the normal range for the PT test is 11 to 13. And the INR test's normal range is 0.8 to 1.2. But when using warfarin and we're using INR to measure the effectiveness, the therapeutic range for the INR test is 2 to 3.5. And an INR test in that range is going to determine that your warfarin treatment is being effective. The BUN test, or the blood urea nitrogen, is a measure of BUN that actually is a substance in your urine or in your blood. BUN is a part of the metabolites that are a result of protein metabolism, and the purpose is that they are filtered and excreted by the kidneys. So when you're doing your BUN test, if your BUN value is too high, that means your kidneys are not functioning properly and you're not excreting enough. If your BUN is too low, that means that your kidneys are doing too much and they're excreting too much. So the normal lab value range for the BUN test is 7 to 20. Next, we're going to be discussing some visual diagnostic tests and potential safety concerns along with each one of them. To start off, what will likely be the most common in our practice are x-rays. As we all well know, x-rays are used to visualize bone, to assess for any potential fractures. But the safety concern to understand is that with x-rays, usually multiple scans will be needed for a full assessment. So you're gonna have multiple views at multiple angles to get a full picture of what could be wrong. So I believe in this instance, patient education is the most important, is making sure the patient understands completely what they're about to go into, because the x-ray team is obviously going to assist with any other safety precautions necessary. For the MRI meaning magnetic resonance imaging, we are going to be using that to look at layers of the body, very often used to scan for tumors, look at the brain, and since it uses magnets, we need to make sure that metal is not involved in the picture. So things like credit cards, hearing aids, or jewelry need to be removed, and it needs to be communicated with the patient that, hey, if you have any of this stuff, you need to make sure it's removed, or else it can mess with the machine. Additionally, just general good patient education, letting them know what the experience is going to be like. The MRI machine is not very spacious, so if a patient struggles with claustrophobia or something like that, it could make them more adverse to the procedure and just overall not have a good time. So lastly, the CT scan is used to observe soft tissue, and this was also one of our quiz questions. Something important to note is that if a CT scan uses contrast, we need to assess for patient allergies to make sure that they're not allergic to the substance being used for the contrast. So with CT scan, assess for allergies if contrast is used. Next, I'm going to go through the teaching required for specimen collection, and that's going to cover urine, stool, and sputum. When looking through our chapters for this content, the biggest thing I saw about urine collection is privacy. Because the patient, it could become very embarrassed being told, I need you to go pee in this cup. I know our professors harked about it when we had to do our drug tests. It could become uncomfortable at first to do what needed to be done. My suggestion would be to review the practices for things like a clean catch or how to collect a urine specimen from a Foley. That may be included in what we need to know. But when it comes to teaching a patient, it's just really important to make clear the proceedings for the collection itself, to just kind of help them feel a little more at ease and to give them a better understanding of here's what I need you to do and why. In general, it's always just good practice to be as transparent as possible with your patient to really maintain that patient autonomy so they understand their care and they can make an educated decision to go through with it or not. Now I'm going to discuss the education necessary when collecting stool samples. The biggest thing here is that there are a few things that you need to educate the patient on avoiding about 72 hours before their stool collection. And the biggest reason for this is because these things are commonly associated with false positive results on things like occult blood and parasites. So those things are red meat, vitamin C, and NSAIDs. Just wanted to have it up on the board for you there. Just major things to avoid, and it's important to educate the patient about that well in advance of their collection, just to continue to maintain that patient autonomy, give them the understanding of why we're doing what we're doing. So last for sample collections is sputum, and the biggest thing to take note of here is just pretty much how to properly collect a sample. It's important to avoid contaminating the patient's sample and making sure it's not mixed with anything. So the first step is to make sure that you get the sample before the patient has had anything to eat or drink. So we want to make sure we get it before the first meal. Following that, you want to make sure the patient clears their nose and throat as well as rinses their mouth. And you want to have them get rid of all of that because that's where the contaminants come from. So we want to clear nose and rinse mouth. And then you'll have the patient take a few deep breaths and cough the sputum into a sterile container. So we're going to cough after deep breaths. And if that doesn't work, we're recommended to administer a hypertonic solution via a nebulizer to retrieve that sputum. And that's just kind of what differentiates this from a urine or stool collection. This requires pretty active participation from the patient that's outside of normal bodily function. So this is just why it's important to educate the patient on how to properly create a specimen for us to take and have laboratory examine. So you would say administer hypertonic solution via nebulizer if the breathing and coughing technique doesn't work. So I just want to have it up here again for people who are a little more visual. I am not a great penman, but at least it's there. Next, we're going to be discussing cholesterol. Not only what some normal values are that we'll be reviewing, but also what does each part of cholesterol do exactly. First thing to know is that your total cholesterol is a summation, and it is your HDL plus your LDL plus 20% of your triglycerides. So just so you have that, total cholesterol is HDL plus LDL plus 20% triglyceride. Now, to get more into what each substance is, your triglycerides are a source of energy. They increase after meals and they're affected by stress. So we'll say triglycerides, energy source. And I'll actually move over to LDLs first because they are transporters of triglycerides to the cells. The issue is that they sometimes deposit cholesterol on the tissue of arterial walls, and that's when clots can form. That's why we focus on that so much, where anticoagulants come into play. It's when there just isn't enough, or there isn't enough HDL, or there's too much LDL, and it's depositing those triglycerides and cholesterol on the arterial walls. But what LDL actually does is it transports triglycerides to the cells so they can use the energy. So I'm just going to say transports to cells. Now, this risk of depositing cholesterol on those walls is where HDL comes into play. The purpose of HDL is to come and extract that leftover cholesterol from the arterial wall tissue and cells and take it to the liver for excretion. Now, just a quick review, your total triglycerides should be around 200. You want your HDLs to be greater than 40 and your LDLs to be less than, I believe, 160-ish. Ideally, the more of these, the better. The less of these, the better. But the purpose of HDLs is to remove excess cholesterol from the arteries. So that's what I'm going to write. Remove excess cholesterol from arteries. And there you have it. One of the last things I want to discuss are necessary assessment and questions to ask the patient before their diagnostic test or lab assessment. So just to go through that, I've got a little fill in the blank here of what will be some common assessment questions. So first would be, we need to ask the patient, Do they have any medications they're currently taking? And if they have any allergies. We need to ask the patient if they consumed alcohol in the last 24 hours. We need to ask the patient about their pregnancy status. We need to ask the patient if they've made any sort of preparations for the diagnostic. And we always need to make sure that we take a set of vital signs. You always want to make sure you have that baseline before the diagnostic test, so that way when the patient returns, you will know that if something's changed, it was most likely the result of the test. So I just want to leave this up here for a quick second, take a look at it. I would highly suggest, if this is something you know you need more review on, come back to this part of the video and go through the fill in the blank and try to answer the questions before I do. And one last thing I want to talk about, just because it was in a weird place on the study guide, is the hemoglobin A1C test. Because it seems to be important that we know what it does. So just a quick definition, this test measures your average blood sugar over a period of 3 months, and the purpose is to diagnose prediabetes or diabetes. So just for the visuals out there, measures average blood sugar to diagnose diabetes. I really appreciate anybody who used this resource to help them learn. I know making these videos has been super helpful for me, retaining the information and really putting it in a way that is much more easy to digest. I'm gonna make sure comments are turned on for this one. I saw on the first one they weren't. So if you see that there's anything you saw that I missed that you think is crucial for our cohort to understand, please let me know. Otherwise, if there's anything I can do to make these videos a little more easy to sit through, I appreciate and welcome any criticism and constructive feedback. So thank you guys so much.